Community Analysis Presentation, Port Richey, Florida, by Cynthia Cortez for St. Petersburg College. The objectives of this presentation include historical overview, community analysis, prioritized community analysis, and global community issue. In 1883, Aaron M. Richey traveled south from St. Joseph, Missouri, and settled down by the Pythlachescody River, the area currently known as Port Richey, Florida. By 1884, he had opened a post office, located inside his own home. However, he didn't stop there. He went on to open the first convenience store for fishermen and other settlers of the area. Over time, more settlers traveled, and by 1914, the community held a 4th of July picnic at Nick's Grove with nearly 200 settlers in attendance. Many people enjoyed the area, settled in, and bought up land and started various businesses. By 1922, a resort hotel was built that advertised home-cooked meals, hunting, fishing, and the use of a boat. The city of Port Richey became incorporated in 1925, with Charles Hoffman serving as the first mayor. The small city thrived and continued to grow. A firehouse and city hall were built in 1961, and a new post office by 1974. The Gulfview Square Mall opened in 1980. The small waterside city of Port Richey is approximately 2.2 square miles. The city's northern boundary is approximately at Stone Road. Its southern boundary is approximately at Broadway Drive. The eastern boundary is around Heather Street, and the western boundary is at the Gulf of Mexico. The city's major roadways include U.S. Highway 19, which runs north and south down the middle of the city, and Ridge Road, which runs east and west. Many businesses and restaurants line both major roadways. There is a Walmart Supercenter at the corner of Ridge Road and US 19, and the Gulfview Square Mall is located on the northern city border by the US 19. The largest grocery store is Publix, located on Ridge Road and Regency Boulevard. Port Richey meets the needs of its community members. There is plenty of housing in the city of Port Richey. There are 1,777 housing units with 350 that are unoccupied. 979 are owner-occupied. The majority of the homes and neighborhoods are newer, with homes that appear to be in good repair with well-manicured lawns. There are a few housing areas that appear run down and overgrown. Most residents drive their own cars from place to place, but there's also a Pasco County public transportation bus that makes frequent stops all around the city. There are many taxi services available as well, and the major roadways have bike lanes and sidewalks. As previously mentioned, there's a Walmart and a Publix located within the city limits, and many other smaller stores available for residents to purchase food and merchandise. There are several churches in the area, including the St. James Apostolic Catholic Church, Eagles Landing Baptist Church, and King of Kings Lutheran Church. There are cultural influences throughout the city, with several Latin supermarkets and a Portuguese-American Cultural Association. Structurally, the city appears fairly new. However, there are several homes and businesses that are currently unoccupied. The city has worked hard to maintain the roadways, and US 19 is currently under reconstruction. The major roadway median lawns are mowed, and there are flower beds and bushes planted and kept well trimmed. The major roadways have adequate signage, and they're well lit at night. There are a couple of structural issues that could be addressed that could improve the city for its residents, such as adding bike lanes to the minor roadways and adding sidewalks to areas that currently don't have them. These would allow the residents to be able to have a safe place to ride their bicycles and walk. If more residents could walk or ride their bicycles, then fewer cars would be on the roadways, which would serve to cut down on air pollution and allow residents to exercise more. The city of Port Richey has approximately 2,700 residents. The majority are ages 55 to 64. 92% of the population are white, 6% Hispanic, 2% black. 92% of the population is employed and 8% are unemployed. Only 9% of the population falls below the poverty level, which is 2% lower than the statewide average of 11%. Most of the residents are in the upper middle income and above income level. 92% of the population are high school graduates, 31% are college graduates, and 12% have a master's level college degree. The population of Port Richey is mostly older, with 55 and older, and require good access to health care as they age in order to maintain their health. The majority of deaths in Port Richey are caused by cardiovascular disease. An aging population with low activity levels, poor dietary habits such as eating foods high in fat and salt, and weight gain contribute to community health concerns, including cardiovascular disease. The citizens are at high risk for obesity, diabetes, cardiovascular disease, as there is an abundance of cheap fast foods available and little opportunity for exercise. The city of Port Richey has the Gulf Coast Clinic, which offers physician services for several specialties including cardiology and gerontology. Several short miles away in the city of Newport Richey, Morton Plant North Bay Hospital provides emergency and acute care services to both communities of Newport Richey and Port Richey. There are several skilled nursing facilities and assisted living facilities as well. The Gulf Coast Clinic and North Bay Hospital both accept acute care patients, and they accept a variety of insurances including Medicare and Medicaid. North Bay Hospital is also not-for-profit, and they provide free care to those who do not have insurance. The skilled nursing facilities rely on Medicare reimbursement and private insurance or private pay. Assisted living facilities accommodate those with Medicaid and those who can privately pay on their own. The first community health objective taken from Healthy People 2020 is NWS 6.1, which states, increase the proportion of physician office visits made by patients with a diagnosis of cardiovascular disease, diabetes, or hyperlipidemia that include counseling or education related to diet and nutrition. The leading cause of death in Port Richey is cardiovascular disease. Increasing physician office visits may decrease the risk of cardiovascular disease and its complications. Community objective number 2 is NWS 8. Increase the proportion of adults who are at a healthy weight. Healthy weights can lower the risk of diabetes and cardiovascular disease. Community objective number 3, PA 2.4, is increase the proportion of adults who meet the objectives for aerobic physical activity and for muscle strengthening activity. Adults who exercise are at decreased risk of cardiovascular disease and diabetes. Port Richey's environmental resources are adequate. Port Richey obtains 70% of its water directly from the Florida aquifer through 7 of its own wells. The city obtains the other 30% of its water from the city of Newport Richey. Sewage is adequately managed and treated by the city of Port Richey. Pasco County is responsible for Port Richey's solid waste, and there is a West Pasco Class 3 landfill located in nearby Spring Hill. Private waste management companies pick up waste at homes and businesses and take it to the county landfill. Recycling is not mandated by law, but it is available to citizens on a voluntary basis. Unfortunately, 3 of the recycling sites were recently closed, but 3 sites do remain open and in operation. Since Port Richey is located on the Gulf of Mexico and derives the majority of its water from the Florida aquifer, it's necessary to maintain clean waterways for the health and recreation of visitors and residents. The city routinely checks the water for contaminants and treats the drinking water to ensure its safety. They publish an annual water quality report. Also, the air quality in Port Richey is much lower than the national average. The majority of the revenue coming into Port Richey is from property taxes, and the majority of the expenditure is in law enforcement. The city of Port Richey maintains a balanced budget which is approved by the city council and published every year. The city also operates around-the-clock emergency 911 services and firehouses. There are published disaster plans and clear evacuation plan. The public officials for the city of Port Richey serve a term of 2 years by a public election process. This mayor, Eloise Taylor, is a lawyer by occupation and opened her Hudson, Florida law firm in 1982. She's held the City of Port Richey mayor position for a total of 5 terms. One area of concern is that Port Richey doesn't seem to have a good backup plan for economic shortfalls. What would the city do if it couldn't meet their budget? Lay off city workers or decrease the public services? Also, 8% of the population are unemployed. Even though many of those are likely retirees, the city needs to do their best part to ensure that job opportunities are available. They need to keep businesses open, and many of the storefronts in Gulfview Square Mall are starting to close down. Community diagnosis number 1 is ineffective health maintenance among adults, and that is because the adults in Port Richey are at high risk for cardiovascular disease due to a lack of adequate health maintenance, and obesity, diabetes, inactivity, and a diet high in fat and salt. This should be the number 1 problem, as health maintenance is very necessary for the reduction of heart disease. Problem number 2 is impaired nutrition, more than body requirements. Adults who eat more than their body requires are at risk for weight gain, obesity, diabetes, and heart disease. Community diagnosis number 3, knowledge deficit among adults related to lack of knowledge of health maintenance. The adults of Port Richey need to receive education regarding maintaining their health, including exercise, proper diet, and seeing a physician regularly. Activity intolerance among adults related to poor health, obesity, diabetes, and heart disease. Adults who are inactive lose vitality and become intolerant to activity, which worsens their problems. Community diagnosis number 5 is self-neglect. Adults in Port Richey are neglecting themselves when they do not care for their bodies properly. And number 6 is low self-esteem, which can happen when adults don't care for themselves and are chronically ill. The global community issue that is the primary one for Port Richey is improving access to basic healthcare services to improve quality of life. In other countries, access to healthcare is being promoted through the Health for All in 21st Century Healthcare campaign. In the Port Richey community, healthcare programs need to be established that will allow the population to be educated regarding health maintenance and the need to have access to a primary care physician and basic health services. This is an issue for the City Council, and it needs to be addressed and incorporated into their budget and their city plan. The role of the community health nurse is to assess the needs of the community, diagnose its issues, and plan for improvement. Implement the plan and evaluate the outcomes. Community health nurses play a leadership role in the general health and welfare of the community. They bring the qualities of knowledge, guidance, and skill that can greatly improve the health and well-being of their community. This is the end of my presentation. Thank you.